Hello, my name is Philip Mease. I'm here at the ACR meeting in San Diego. I'm a rheumatologist from Seattle, Washington. I'm very excited about one of the late breakers that's being presented here, which is known as the Future 5 study. This is a study that is the largest that has been conducted in psoriatic arthritis using the drug secukinumab in 2 different dosages and 1 dose arm without a load. As you may know, secukinumab is approved 300 milligrams or 150 milligrams, given 5 weekly doses and then monthly thereafter. And in this study, in which we were testing to see if it would inhibit radiographic progression, there was also a quote, no-load dose that was given at baseline and monthly. So what did we learn? Well, not a surprise, we learned that giving secukinumab did inhibit evidence of progressive structural damage in joints as measured by X-ray. So that was a key outcome from the study. It also confirmed previously known results in terms of very high ACR responses, for example, ACR 20 at the primary endpoint of week 16 of about 63%, which is very high, and correspondingly high ACR 50, 70 responses, and very high skin responses. We also saw significant inhibition of dactylitis and enthesitis at week 16. If we turn to what we learned about loading versus not loading, we learned that the load is better. There were numerically higher responses with the 300 milligram and 150 milligram doses when given a load than with no load. And the responses were faster. We also saw differences in enthesitis and dactylitis response. So my take-home message is that it's better to follow the current recommended dosing of giving a load, and then in patients with moderate to severe psoriasis, giving 300 milligrams, 150 is also an option because that did show, like the 300 milligram dose, evidence of inhibition of radiographic progression, all supporting the effectiveness of secukinumab in treating psoriatic arthritis with this IL-17A inhibitor.